Welcome, Lipstick and Logic. I just got out of the OR, and I'm super excited to be sitting here with you to talk about.
What are we talking about?
We were just at the meeting this week, so let's do a lipstick check. So
we're at AMWC, the largest anti-aging medicine world congress that exists. 18,000 participants.
It was something like that.
Okay.
So all over the world, people come from Monaco, experts to learn about the latest breakthroughs. And I know you were on a lot of interesting sessions. I was in a lot of interesting sessions. But give me a check. Give me a lipstick check.
Yeah. So something I probably was most impactful was the integrative dermatology session that I was in. And it was so great to be on this because I sat with an integrative medicine doctor who actually started off as a pelvic floor specialist, a skin biologist, and one of my dearest friends, Kate Goldie, and then a facial plastic surgeon. And it was so impactful because we covered, we always talk about the foods that we eat.
Right.
It impacts our cardiac health. That can inform potentially our brain health. And it's all about what your ingestible diet. But we forget that perhaps our topical diet means just as much to our overall well-being. And so we covered, and it was actually Kate who brought it up, this paper that came out of China where they were in a nursing home. They took one group and they applied an emollient to their entire skin every single day for 3 years. And then they took another group and they didn't do anything to them. No topical emollient. And 3 years later, the group that had the topical emollient had better cognition, and the other group had statistical significant cognitive decline. And so 2 takeaways from that trial. Was it the touch from applying an emollient to your entire body every single day in a nursing home where people are isolated and have no connection that had an impact on oxytocin levels that led to improved cognition when their largest organ was basically being touched? Or was it taking care of your skin and decreasing the inflammation in your skin by improving skin barriers so that topical stressors don't get in and cause more inflammation, can then inform the rest of your body. You can have better cognitive function because we know the skin-brain axis. I mean, we were one of the first to publish on it, but we know that there's a gut-skin axis. So when you take care of your largest organ, that means better health care for the rest of your organs.
So I want to emphasize this because you bring up a really important point, and it's critical that people understand this. I pulled that article, I read it on the plane ride home, and because you got me so interested in it. And they did talk about how when you put this emollient on, you prevent inflammation of the skin. You protect the skin. And as you get older, your skin gets drier, you have less collagen, your skin barrier breaks down. They looked at transepidermal water loss. So you have less transepidermal water loss in the patients who did the emollient. They did it all over their whole body, whereas the control group just did their hands and face.
Right.
So it's a big difference. It went on for 3 years, every single day, twice a day. So that's a big difference.
Yeah.
Now, people don't think about the inflammation and how the skin inflammation affects your whole body.
Well, we think about the heart inflammation and how it affects our whole body.
We think about the gut, right? People talk about the gut.
Or the gut inflammation, all this probiotics and all these things people do for their gut. But we don't realize that our largest organ could be impacting everything else. So we know in cases like psoriasis, people that have, inflammatory plaques have been associated to have a greater cardiovascular risk. And so we know that the skin, inflammation at the level of the skin can actually be associated with inflammation internally, right? This is not like a new concept, but can decreasing inflammation in the skin be associated with decreasing inflammation inside? So it's not just your cognition, it could be your heart, it could be your other organs as well. So if you decrease inflammatory entrance into your skin, you may be helping longevity, overall health and wellness. Right, and so then that just substantiates what we talked about in our last episode, which is could the things that you put on your skin, if they're hormone disruptors or carcinogenic, also inform your body internally in a way that we don't want it to be informed, right?
But what I'm fascinated by here is that it affects the mood and your mentum, your cognition. There's a paper, I think you remember this, I showed it, it was earlier last year in the British Journal of Dermatology, which showed the level of bacteria on the skin correlated with people's psychosocial mood.
Yeah.
And I thought that was so interesting because it was based on Cutibacterium, which is a bacteria that's common in our skin, and whether or not there's overgrowth of that or less of it in certain areas under the axilla or on the face, and they were able to correlate it with mood. So here we go. There's more and more increasing evidence that inflammation, bacteria on the skin has an impact internally, not on only how your organs are performing, but also maybe on your mood.
And that would make sense, right? Because both your brain and your skin stem from the same embryological organ.
Your ectoderm, yeah.
And so they probably are more connected. That axis is more connected than any other axis.
Why have we overlooked this for so long? Why has dermatology overlooked it? Why has aesthetic medicine overlooked it for so long? You're a dermatologist. You came through training with the most extensive training ever. You're fellowship trained.
I don't think we overlook things. I just think we've known things. We just haven't done well linking them together.
Gotcha.
Right? It's just reframing, as with anything in life, right? It's like reframing the way you look at something. And we covered that in our longevity episode. We've been injecting people with fillers and doing laser treatments on them forever. And historically, we've just been myopic enough to believe that all we were doing in a single session was reducing pigmentation or lines and wrinkles, but not recognizing that perhaps we're inducing a biological change in the tissue. Then that's the long-term benefit that we're seeing, not the filler or the singular laser treatment. So we've been doing things for a long time. It's just reframing the way that we look at what we're doing. And in this case, reframing something that is so obvious. We want to care for our heart. We want to care for our kidneys. We want to care for our gut. But why not care for your largest organ? And by doing so, you might have a benefit. If we're talking about longevity, if we're talking about improving the health span of every single tissue, then why not start with the largest organ?
Which is so easy to treat with a topical emollients.
Or care for, right?
Or care for,
because I think that skin care is health care.
Skin care is health care. I love it.
Right. And
did you come up with that?
I haven't seen anyone else mention it.
Okay,
but it is caring for your health. And I think historically we've just kind of brushed derm as, maybe something more superficial. But the skin is sometimes where systemic disease manifests. I remember this being one of my favorite books in dermatology training. And it was written by then chair of Cook County Derm Program. And so the skin can be a window for telling you if there's a systemic process going on. But perhaps the skin can also be the reason for a systemic process going on. It's just looking at the opposite way.
Right, so let's talk about rosacea because it's Rosacea month.
Yep.
Classic case of inflammation on the skin that also influences mood, and they go hand in hand. What comes first?
Right, there's a lot of the skin-gut axis in rosacea, and there's also a lot with the skin-brain axis in rosacea. And we know that rosacea is absolutely an inflammatory condition at the level of the skin, right? And we also know because of that probably that things like alcohol and stress and sleep deprivation and things like they've even associated it sometimes with what you eat, more inflammatory diets, right, can make you flare, can make you have a trigger. So if you decrease those things, which is, perhaps the reason why we see it improve. We decrease it with lasers. Before it was because we were closing the blood vessels, and that's why it improved the skin. But maybe it's because we decrease inflammatory mediators at the level of the skin, which we've shown
which are then being systemically absorbed.
Then perhaps this is why, right? So if you treat the rosacea, the curious thing would be looking at the gut microbiome. If we treat the rosacea, the curious thing would be, instead of the reverse, we always look at the reverse. We always look at, well, if you manage the gut microbiome, then the skin will be better. But it's a feedback loop, and they both impact one another. One is not the only one informing the other. They're constantly in a loop informing one another. So it's really, something that I feel passionate about. And I published back in 2014, a holistic approach to anti-aging, which was something that I published in Derm Surge. From the diets that we eat, from the sleep that we do, from our topical diet, all of these things impact not just our skin, which just happens to be the window to it all, but also what happens inside.
I published an article about 10 years ago or so on injecting botulinum toxin into the skin to treat rosacea. And that was pretty progressive thinking at the time. But when I wrote that, I talked about how you're reducing sebum activity, but you're also reducing some of the neuropeptides in the skin, from vasoactive intensive peptide, VIP, to substance P, and reducing some of the mast cell release of histamine. And all of those had an impact on the neurovascular influences that cause rosacea, which is so interesting because now as we come back with oxytocin, we've been talking so much and writing and researching oxytocin, these neurohormones in the skin have such incredible value to skin health.
100%. So with acetylcholine, that's maybe a neuropeptide you want to inhibit, and then you get your result, right? Or substance P, you want to bring down, and then you get your result. But then there's things that you want to maybe bring up to get your result. And you can leverage oxytocin as one pathway where, there, obviously we know that you don't even need an absorption of oxytocin. You just leverage the Piezo receptors, which are mechanical receptors at the level of the keratinocyte. That is just an ion channel. You could easily have a peptide bind to the ion channel, which we've been able to effectively do through OX factor. That ion channel activation causes the release of oxytocin through keratinocytes. And then there is a signaling pathway because that oxytocin also binds to your dermal fibroblasts and to your immune cells in your dermis. And this all causes a decreased inflammatory state at the level of the dermis.
And this is not requiring the product to go absorb deeper into the dermis.
We don't need a liposome
it can be topical,
or some type of vehicle for it to be carried down. Because once you get ion channel activation, that's all you need for the oxytocin to be released. But it's Mother Nature's it's your strongest antioxidant and one of the strongest anti-inflammatories.
You're talking about oxytocin.
Oxytocin.
Right.
And so by leveraging that, you can decrease redness. And because it's such a it draws in water in the dermis, it is able to also hydrate that dermis so that it doesn't signal to your blood vessels and your immune cells that it's
now, oxytocin prevents free radicals. I've heard you talk about that before.
Well, because there's receptors for it. So you don't have the actual reaction to create the free radical.
So you don't get that inflammatory process where you have the oxidation.
Or that you need even a scavenger to scavenge
scavenger
for free
being
radical.
Something like superoxide dismutase.
Or lycopene or all these other antioxidants that exist in the market. Right.
Wow, that's fascinating. So it's really interesting now. You're seeing the skincare is becoming this futuristic new platform for treating overall longevity, health, and wellness. Like one time it was brush your teeth and you have less cardiac disease. Eat well and you're gonna do better. You're not gonna have inflammatory conditions that may cause from eating poor food because the gut's leaky. Your skin's leaky.
Your skin's leaky, right? I mean, it's like, and we talk about flora. We're talking about gut flora. It starts in our mouth.
Yeah.
So it's like you want to, maybe do something for your skin that's associated with your gut microbiome. Start by flossing twice a day, right? And the reverse might be true too, right? Put something on your skin that's not irritating it to try to clear your pigment, or that's like sloughing it to try to improve a line or wrinkle, and your gut might respond better. But we're just learning, and that long-term trial out of China was really pivotal in being able to show us the power of the integration between organs.
All right, let's get to doctor's orders. Okay. So tell me what doctor's orders do you have based on your learnings from coming back from the meeting and some of the stuff we've been talking about, integrative dermatology.
Well, I would say that Rosacea, for Rosacea Awareness Month, it's something that I actually have too. I suffer from that condition. And so I was sensitive in creating something to help support it, at least not worsen it, because there's a lot of irritants and a lot of topicals that we use that can make rosacea worse. So it's not just what's in the product, it's what's not in the product that's important, right? So for Rosacea Month, I would say that a lot of the prescriptions are great. They decrease that maybe over colonization of particular organisms that might distort or disrupt your microflora that participate in the creation of rosacea. But making sure that you still care for your skin with good skincare is as important. The prescriptions serve a role in mitigating that flora, but also you need to care for that barrier. And I love my XOMD serum and moisturizer to do that. And I love not stripping it too much with an irritating high pH surfactant that you may find in some cleansers. And so this really is great for my sensitive skin prone.
9 surfactants in there, amphotericity, so meaning they kind of go back and forth between positive and negative, so they're really gentle on the skin surface.
Right, so you don't have a really high pH product.
And really sensitive to the skin. In fact, people are using it, and you use it post-procedure.
Yeah, and that for rosacea, it's not just the face, it's the neck and chest that a lot of people will complain is also sensitive or can flush. And so I love to use it and work it down to the neck and chest as well.
And that's why you created it.
Exactly.
All right, doctor's orders for me is, hey, guys, we're getting much deeper. It's not about collagen. It's not about elastin. Those things are important. But now we're starting to really recognize the skin-brain axis. And I'm so thrilled that these articles are coming out that are corroborating a lot of what we've been talking about for a while, is that your skin is really a social signaling sensory organ. It works not only for yourself as you kind of relate to yourself based on your skin quality, and it has an effect on your psychosocial aspect, but also influences other people around you and how they treat you. And I love where we're going with this, that our skin is one of the most important organs we have, and that we need to care for it appropriately.
Yeah, I think when you just said something that's so important, like we focus so much on like collagen and elastin, but if the environment that collagen and elastin is in is optimized, which hormones do the best in optimizing it, then the collagen and elastin, the treatments that stimulate it, are going to perform better, are going to do better, right? And same is true. It's like if you only focus on one cardiac plaque. If you only focus on your one plaque, who cares if you've got other plaques scoring because the environment hasn't been optimized. It's about improving the entire environment of your cardiovascular system that's going to help so that no plaques build, right? So it's like we have to focus on the environment. We can't be so myopic to only focus on one plaque or on just collagen and elastin.
And it's so easy to treat the skin well today.
Yeah.
We just don't do it enough.
So,
all right.
Happy Rosacea Month, guys.
Yeah. This was great. I learned a lot today. Thanks.
Yeah, thank you.
All right. Well, we'll see you next time.
Bye.